I will present 4 cases that I think are quite interesting. The first one is about a 55 years old man that had the previous refractive surgery. I saw him just after the lockdown in May, and he had a corrected distance visual acuity of just 0.3, regular flat cornea after LASIK, as you can see. There was a nuclear cataract. The astigmatism, the keratometric astigmatism, which is the difference between K1 and K2, was slightly below 1 diopter, and it was slightly lower with total corneal astigmatism within the power distribution display. A very long eye, 30 millimeters. And this is one of the most beautiful things that you can see on the Pentacam wave. When the patient asked me, why cannot I see? Well, as I did before, if you show a display like this, where the internal quality of vision is really awful, it's easy to directly show to the patient what's happening in his eye. And I said, okay, the internal optics of the eye are not working anymore. They have to be changed. You see, the cornea is not so bad. And how can I use the Pentacam to make calculations in post-LASIK eyes? Here, you see that the target refraction for this eye was minus 1.5, and this was one of the reasons why I did not want to correct that little astigmatism. Probably if I aimed to emetropia, I would have correct even 0.7. And you see the different options available, easily available on the Pentacam. That means the Barrett 2K, the Hill-Potvin Shammas post-myopic, and now we have also the Olsen ray tracing, which is a ray tracing that takes into account every little point on the cornea, a great advantage. And you see that the calculation was ranging between 16 diopters and 17. Then I always like to compare the results to the most important sources, like, for example, the ACRS website. Here again, you have the Barrett that provides, of course, the same numbers. And you have some other methods, like masked formula, which I like a lot. And in this case, we had the masked formula uses the laser-induced refractive change, which was minus 7.5. And in many studies I've done, I saw that it is a very good formula, which was providing a lower number, 14.5. So I decided to rely on Olsen rather than Barrett, because Olsen is ray tracing, and I love ray tracing, and implanted 16 diopters. And if you take a look, the 1 month postoperative refraction was minus 1.5 with minus 1 of cylinder, a spherical equivalent of minus 2 diopters, which was exactly what Olsen predicted before surgery. And one more reason to love this approach. And if you look at the post-operative display of visual quality, now the internal optics is perfect, especially if you compare it to the preoperative one.